So as we discussed in our previous video that it is the proteinuria, or on the basis of proteinuria we divide glomerular injuries into the two types. One is the nephritic syndrome, another is the nephrotic syndrome. In the nephritic syndrome, the patient present with the hypertension. Due to this hypertension, what happens? The laminar flow of blood gets the turbulent, and this turbulent flow causes the damage to the glomerular capillaries, thereby causes the hematuria. Okay, so thereby causes the hematuria. You can clearly see because of this hematuria, RBC casts are formed in the urine. So you can clearly visualize these RBC casts in this diagram. Okay. Now let's talk about the nephrotic syndrome. What happens in the nephrotic syndrome? What happens? The massive proteinuria occur. Okay. So in the nephrotic syndrome, massive proteinuria occur, more than 3.5 grams per day. Okay, so more than 3.5 gram protein is lost per day, whereas in the nephritic syndrome it is less than 3.5 grams per day. All these features of nephritic syndrome, the hypertension, the hematuria, are also seen in the nephrotic syndrome as well, but they are lesser. Okay, so the feature of nephritic syndrome are also seen in the nephrotic syndrome, but they are lesser in this case. What happens? Due to this massive proteinuria, certain lipoproteins are lost in the urine. Okay, due to which the compensatory mechanism is activated, which causes the increased production of lipid. Due to this increased production of lipid, what happens? Hyperlipidemia occurs, and due to this hyperlipidemia, the lipid is lost more into the urine, causes the hyperlipiduria. Due to this hyperlipiduria, what happens? Lipid casts are formed, or we could say casts are formed. You can clearly visualize in this diagram. These are the casts having clear-cut margins with some cleavages. Okay, what happens in the nephrotic syndrome? Hyperlipidemia occur, due to which hyperlipiduria occur. Okay, so this hyperlipidemia causes the hyperlipiduria. Due to this hyperlipiduria, what happens? Fatty casts or waxy casts are formed. Fatty or waxy casts are formed in the urine. Whatever casts are formed in the urine, they are at the level of distal convoluted tubule. Okay, so they are at the level of DCT. Now what happens? Due to this proteinuria, certain anticoagulation proteins are also lost, such as protein C, protein S, and antithrombin 3. Due to the loss of these anticoagulation proteins, what happens? Hypercoagulability occurs. Okay, so that's why, because of this hypercoagulation, this nephrotic syndrome is known as hypercoagulable disorder. Okay, so what happens? Because of this hypercoagulation occur, this hypercoagulation is also contributed by another component which is known as fibrin. We know that because of the inflammation of this nephrotic syndrome, what happens? Liver start producing certain protein in much more quantity. Okay, so they are known as positive acute phase proteins, and one of them is the fibrin. Okay, so this increased fibrin production also contribute to the hypercoagulable or hypercoagulability. Okay, it must be clear to you. Now the last but not the least feature of the nephrotic syndrome, which is the edema. This edema is also seen in the nephritic syndrome, but the edema which is seen in the nephritic syndrome is much more milder than the nephrotic syndrome. What causes? What factors involved in the edema? in the occurrence of edema. In the nephritic syndrome, this edema is because of the hypertension. What happens? Because of hypertension, what happens? The salt and water retention increases, thereby causes the edema. And in the nephrotic syndrome, this edema is contributed more by the sodium and water retention than hypoproteinemia. Okay, so this must be clear to you. So what happens due to the hyperproteinuria? The fluid from the capillaries oozes out into the interstitial spaces, due to which fluid volume in the blood decreases. This decreased fluid volume in the blood causes the activation of RAS, renin-angiotensin system. This RAS causes the increased production of aldosterone. What does this aldosterone do? It causes the retention of sodium and water. Okay, so sodium and water are retained, due to which the fluid volume in the blood now gets increased, and this fluid now gets oozed out into the interstitial spaces, thereby causing the edema. So the salt and water retention is much more important cause in the generation of edema in the nephrotic syndrome than the hyperproteinemia. Okay, this must be clear to you. Let's talk about the causes of the most common causes of nephritic syndrome. The most common cause of the nephritic syndrome in the pediatrics, okay, in the pediatrics is the PSGN, the post streptococcal glomerulonephritis, and in the adult it is the IgA nephropathy. Okay, A for adult, A for IgA nephropathy. So you can remember it through this mnemonic. If you speak overall, then it is the IgA nephropathy. Okay, so IgA nephropathy is the most common cause of nephritic syndrome in overall cases. Okay, so what all are the causes of nephrotic syndrome? Nephrotic syndrome could be primary or it could be secondary to any systematic illness. Primary, it is because of no etiology. The most common of them in the peds is minimal change disease, whereas in the adults it is FSGS. You don't get bothered by these conditions. We'll discuss every condition in our proceeding sessions. You just write down, mug it up. So in the adults it is the FSGS. Okay, if you speak overall, then it is the FSGS also. Now the nephrotic syndrome can also be caused because of the systematic illness as well. In this systematic illness, the most common cause is the diabetic mellitus, and diabetic mellitus is the most common cause of the nephrotic syndrome in overall cases as well. So this must be clear to you. With this, we are done with the overview, with the clinical presentation of the nephritic and nephrotic syndrome. I hope you would enjoy the lecture.